I guess let's start first of all and say happy birthday to Dr. Joe Congeni.
Oh, my gosh.
What are you, 35?
Oh, it's something like that. I've been around so darn long.
You feel 35, though, don't you?
I don't know. I hope so.
Man, you are. Used to think that I was on the run a lot. You're on the run much more than me.
I don't know. I got to slow it down somehow now.
Okay,
my last one, senior in high school this year, graduating this weekend.
Oh.
Yep, number 6 is graduating this weekend. So we've been around the high school circles and everything so long now.
High
So that
schools
may
and
change
colleges.
things at home. Yeah, that may change things.
Maybe you can get away a little bit more.
Yeah,
you deserve it, for sure.
I hope so.
Hey, let's start. First of all, you wanted to talk a little bit, Kyrie, with a little bit of an ankle
Yeah,
twist.
you know, there's a new NBA study, ankle sprain study. It's authored by a guy by the name of Kyrie Irving, and his study and a few other people have gone along with it is the way to treat ankle sprains is just remain on the floor, tie your shoes a little bit tighter, and then all of a sudden you'll be able to continue out there and play amazingly for the next 10 or 15 minutes of play. I know that really confuses a lot of people because it looks like a bad sprain, inversion sprain, and a lot of us, when you're caring for younger athletes, when they have a bad sprain like that, there's no way they're lacing their shoes up tighter and returning to play, and they limp off the court and they get help off the court and they have a big swollen ankle and things. One of the differences, and again, we don't know these players specifically as to what's gone on, but by the time you get to the level of LeBron's had these in the past and Kyrie's had these in the past and Kawhi had a big issue here recently, much of the time, they've had multiple sprains. Remember, sprains are torn ligaments in the ankle. The ankle would be a joint that would be very common for this. So you stretch and then tear the ligament. It bleeds for a period of time. You go through treatment and rehab and get better and return to play. But what happens when you've done it over and over again? It heals back, but it heals back kind of more stretched out. And what ends up happening is the next time you do it and the next time you do it, you get more of a stretch on the ligament, but those tight ligaments aren't there anymore, so you don't get that torn ligament situation. You don't get the swelling and the disability. So it's really a head scratcher when we see our young athletes who limp off the court, they miss a couple weeks, they have a big swollen ankle, versus last night we literally take a TV timeout and tighten the shoe and he comes back playing so well. And so the only really plausible explanation in a lot of these guys that have played for a long time is they've had multiple recurrent sprains and they're able to deal with it by tightening up the shoe. They don't have the issues again. They may go back in the locker room, you'll see occasionally, to be retaped and things like that, but they'll continue to play. And that's the big difference between the professional athlete and maybe the first-time sprain that you might see in a junior high or high school kid.
That's interesting. So what you're saying is the body adapts.
The body,
basically.
The body adapts to some extent.
Yeah.
Initially, before the first sprain, it's a tight, nice, tight ligament. And then when it tears, obviously there's going to be some tearing of the blood vessels in the ligament and bleeding around the ankle and other things. People take pictures in the emergency room of a big swollen ankle and stuff. And then when you've had this multiple times, you don't get that same sort of a tear. You get more of a stretching type injury. You get a short-term transient weakness. That's the part that's the head scratcher, is usually at least you get the transient weakness and they favor it for a period of time. And Kawhi comes right back and steps on somebody on the bench, and then Pachulia steps on, so he gets stepped on again, and then he can't come back anymore that series. So it's not like I'm feeling great about this thing. I'm still a little bit concerned as we have a couple of important games, I believe, coming up against Golden State probably, where Kyrie could have recurrences of this. But it was absolutely nothing short of sports medicine amazing last night what he did with that ankle sprain.
You know what, Joe, it's interesting you bring this whole thing up, because when I was young and I was playing sports all the time, fast pitch softball and all this stuff, occasionally I get that sprained ankle and my ankle would balloon up. As I've gotten older, I'll step on a curb or step on the side of the sidewalk and I'll twist it a little bit. I'll get this sharp pain for 10, 15 seconds. It'll hurt. I'll feel like I can't move. I'll get up. I won't get any swelling, and it'll be okay. And it's always amazing to me that I don't get is this Similar?
That's exactly what we experience when we've been down the road. And this happens in other joints too, like the shoulder and other areas. Now, what happened with the Kawhi injury is a little bit more of an issue. Is perhaps he had more structural damage, and that's why he could never return to that Golden State series. And so that was frustrating. The other one that was a little bit confusing that affects this series that we've talked about a little bit, that in young athletes get them too, and certainly the professional athletes, is all this talk about the labral tear in the hip.
Yes.
The labral tear in the hip. The labrum is the cartilage which helps the ball stay on the stay in the socket. And so what happens is when it's constantly under pressure, people tear that cartilage and the ball can actually start to move around in the socket. But if it's the type of tear, Ray, and he must have had a recurrence early in the Cavs series where he tore a piece. From what the reports say in the paper, he was actually then starting to get some catching and locking like you would in your knee if you tore the meniscus, which is a much more common thing to tear.
Yeah.
But we get this in the hip. He just couldn't go anymore. So a lot of people with early tears of this labrum, they can play through it for a while and they do okay for a while. But in his case, from what we understand, it was a more significant tear that was really limiting his motion, limiting his ability to run and sprint, limiting his ability to play, and they're talking about needing surgery early on in the end of the playoffs for him. Dr.
Joe Congeni with us, Sports Medicine Center, Akron Children's Hospital. One final question. Corey Kluber's been out a few weeks now with this bad back. Did a rehab start, I think, this week. When we're talking about bad backs and stuff, this stuff is really to keep a big, close eye on, isn't it?
It is. And, of course,
especially for a pitcher.
There wasn't a lot of fanfare about what his MRI showed, so I assume that structurally he looked okay. The more you move into 20s and 30s and things like that, it's kind of that delicate balance between the muscles and, more of these muscular type injuries. There's a lot of muscles in the back. Many of these, though, will have some early wear and tear around the disc. They can get some nerve irritation. We don't know any of that. There's so many structures of the back. It's very difficult. And so the general term by the sports medicine team is back strain, mechanical back strain, or something like that. But in a situation like Corey Kluber, you certainly don't want to go back and run the risk of going all the way back to square one with him. So if you do too much with him early on, he re-aggravates this and we get back into the muscular injury or the soft tissue injury problem again. You go back to square one, 6 more weeks. That's not what we want in the month of May of 2017. We want Corey Kluber healthy in the months of August, September, October, even, hopefully this year. And so from that standpoint, no sense in rushing him along. You see a gradual progression. It's actually the perfect example of what we do with kids is what we call functional progression or gradual progression, where you lay out, say, a 4-week program where you're going to do a little bit one day, skip a day, do your workout, do your PT, do a little workout the next day. I heard somewhere 70 pitches. I don't know if those were all maximum effort off the mound, but that's kind of a pitching progression program that it sounds like he's in the middle of. Near the end of that pitching progression is where you start live with batters in the batter's box, and then perhaps you go down to a minor league site where you can just plug a guy into a game for a couple of innings, and not as much on the line as in the professional. And so that's usually the last step before. So I'd say that in the back protocol, if you will, like the concussion protocol, Corey Kluber sounds like he's in the last stage or two of that, and probably a few weeks away if he doesn't have any setbacks.
Good stuff. All right, Joe, thank you very much.
All right, Ray, have a great week.
You too. Dr. Joe Congeni, Sports Medicine Center at Akron Children's Hospital.